Is acne an infection? That's the question that we're going to talk about today. Welcome, I'm Dr. Arthur Colsky, founder and medical director of Advanced Acne Institute, and we are a dermatology practice that specializes only in the treatment of acne. And we like to share some of our insights and experiences with acne sufferers who are navigating the path toward clear skin. And we hope that you find this information useful, but this is not meant to be medical advice. This is just for educational or informational purposes. So, is acne an infection? So this is a question that commonly is asked by patients at Advanced Acne Institute, and the answer is no. Acne is not an infection. Acne is caused by inflammation. But what about the bacteria? That's another question that's often asked. Well, it's true that in many cases of acne, there can be associated bacterial growth. There are bacteria that normally inhabit our pores and they grow there without causing any problems, and that's part of the normal existence of our pores. But occasionally, in conditions like acne, where the pores begin to get closed off and it changes the balance of the processes in the pores and the oxygen level and the functioning of the pore, the bacteria in those circumstances can oftentimes become overgrown. Now, that doesn't mean that bacteria cause acne. It may mean that the bacteria are making the inflammation worse, so it can make acne worse. So sometimes by targeting the bacteria, we might have some beneficial effects on the development of acne, but it's really not the focal point. It's not the thing that makes acne occur. So acne is not an infection. It can be associated with overgrowth of bacteria that we call colonization, which means the bacteria are just growing there because it's a very nutrient-rich environment inside the acne-prone pores. There's a lot of oil and other substances that the bacteria can thrive on. So they grow and they overgrow. So sometimes intervening and affecting the bacterial growth can be important and helpful, but it is not typically the root of the problem. And there are other things that we need to talk about in a future discussion about what's the root of the problem and how to intervene to more effectively stop acne formation.